Welcome, everybody. We're really glad you're here. The purpose of the meeting is, well, two meetings really, but is to inform you of the work we've been doing and of what we've learned, and to explore opportunities to hopefully build public engagement capacity locally. Our focus for our initiative has been on issues that impact health, but that's not as limiting as it might sound. It's important to realize that virtually any decision that's made can have some impact on health. So streets, planning and zoning, budget priorities, all sorts of things. I want to just make a quick note that we will be recording the meeting. So in just a minute, you're going to hear that annoying Zoom voice warning you of such.
Recording in progress.
And I want to take a minute just to introduce our team members or have them introduce themselves. Let me start with Liz Granette.
Everyone, I'm Liz Granette. I'm the Executive Director of Community Justice and Mediation Center, and it's good to see you all this evening. Thanks.
And Lisa Marie, are you feeling up to introducing yourself?
I could say hello and thank you for being off video. It's wonderful to see everyone, and I'm really grateful to be here with everyone. Thank you.
And Elsa?
Hi, I'm Elsa. I'm the Marketing and Communications Assistant for the CVH project.
Stephanie?
I'm Stephanie Richards of Gnarly Tree Sustainability Institute, and our organization is consulting on research and data analysis for the project.
Nancy?
Everybody, Nancy Richmond. I'm the chair of the steering committee and on the infrastructures committee. Thanks for all being here.
Wilson?
Hello, everyone. I'm Wilson Mosley, nonprofit management intern with CGEM and also a student at IU. Very happy to be here.
Lucia?
Nice to see everybody. I'm on the steering committee and here to do a bit of note-taking.
And Terry?
Good evening, everyone. Terry Ensler. I teach at IU, and I'm a member of the steering committee for this Community Voice for Health in Monroe County. Good to see you all.
Did I get everybody? Okay, I have a few Zoom details to mention. If you are a member of the public or the press, welcome. We're glad you're here. We would love to know who you are. So if your name is not in your name label on your little Hollywood square, it would be nice if you would share that information with us. And then we ask that you please turn your video off, because the people then whose cameras are on will be at the front of the gallery, and that way our invited guests can all see each other and be in a meeting together. And also remember to stay muted unless there's a reason for you to speak. We have a packed agenda, so without further ado, I want to introduce our first presenter. Community Voices for Health is blessed to have two organizations that are available to us for assistance and guidance, and one of those is Alterum, an organization that's focused on equitable health policy. Amanda Hunt is the director of Alterum's Healthcare Value Hub. She's provided us with immeasurable guidance all the way through our process, and we're very grateful to her for that, particularly with regard to equitable and person-centered policy. We're glad to have her in our corner, and with that, I will turn it over to her.
Thanks, Jill. I'm going to go ahead and ask my colleague Annalisa to go ahead and share our slides.
Give me 1 second. Alrighty.
Okay. So hi, everyone. As Jill mentioned, my name is Amanda Hunt, and I'm one of the technical assisters who's been involved with the Community Voices for Health project pretty much since its inception. And I've spent a lot of time over the past couple of years working very closely with the groups that were awarded funding. I'm going to kick things off with a brief introduction to Community Voices for Health to lay the foundation for the rest of the discussion we're going to be having tonight. Next slide. Community Voices for Health is a 3-year project that's funded by the Robert Wood Johnson Foundation, which is the nation's largest philanthropy dedicated to building a culture of health. And the goal of this project specifically is to build stronger, more sustainable systems of public engagement so that a broad range of people's voices are heard in health-related policy decisions. Put another way, this project aims to elevate the voices of community members to ensure that health-related decisions made at the local or state levels are responsive to community members' goals and needs. Next slide. Before I share a little bit more about the project, I want to take a moment to collectively consider what health-related policy decisions are. I think for most people, what immediately comes to mind when they think about policymaking around health are state, local, or organizational policies related to healthcare. But the truth is that our ability to live healthy lives depends on many factors outside of the traditional healthcare system, including housing, transportation, the layout of our communities, and more. Take, for example, land use policies that keep the air free of pollutants that make people sick, or the expansion of a public transit system that eliminates barriers preventing people who can't afford a car from seeing a doctor. Zoning restrictions that determine the placement of a new grocery store might seem unrelated to health, but the reality is that they can have a huge impact on people's ability to access fresh and nutritious food to feed their families. And if you understand that policy is giving us clean air, transportation to health services, and access to nutritious foods support health, then the logic follows that land use, public transit, and city planning decisions can also hurt health if those decisions are made without the potential health impacts in mind. Next slide. And there's ample research evidence that supports this. Studies have shown connections between physical activity and the layout of a community, local food environments and the prevalence of diabetes and obesity, social isolation and mental illness, and even zip codes and life expectancy. So the map on the right-hand side of this slide is from a study that was conducted by Indiana University, showing that life expectancy in central Indiana varies up to 10 years depending on the zip code you live in. The green areas are the zip codes with the highest life expectancy, and the red areas are the zip codes with the lowest life expectancy. And the star there at the bottom is Bloomington. So you can see that this is not only something that is happening in our country and your state, but it's also something that's close to your community. Next slide. Coming back to Community Voices for Health, funding for this project was awarded to groups in 6 states who submitted proposals to make public engagement around health more inclusive and sustained by expanding engagement techniques and involving groups of people who have traditionally been underrepresented in policy discussions, more informed through working collaboratively with community members to understand issues affecting their well-being, and more influential by ensuring strong pathways of communication between community members and their policymakers. Next slide. Community Voices for Health projects are happening all across the country in Pennsylvania, Indiana, Georgia, Colorado, New Mexico, and Nevada. And while each of the 6 projects aims to accomplish the same overarching goal, each project is taking a very different approach to get there. In Georgia, for example, the project team is equipping community health workers with the skills and resources they need to serve as community champions and effectively advocate for policy changes on underserved community members' behalf. The project team in Colorado is working to create a stronger community engagement infrastructure to ensure that policy change is both community-driven and culturally relevant, specifically by helping African-American residents feel more empowered to participate fully in the state-level policy decisions that affect them. As Jill mentioned earlier, the project is supported by Public Agenda and Altarum, the organization that I work for. And we lend our collective public engagement and health policy expertise to support the project teams in their work. And with that, I'll turn things over to Liz to talk about what this project looks like in Indiana.
I'm muted. Yeah, thanks, Amanda. Appreciate you being here with us this evening. And I get the pleasure of providing for everyone. I know a lot of you are involved and have on our advisory council and have sort of heard and seen some of my slides, but I'm excited and have the pleasure to kind of provide a very quick and brief overview of the Community Voices for Health in Monroe County story. And I think really we launched this project in April of 2020. And so nothing like launching a 30-month public engagement initiative that aims to kind of meet people where they are so that we ultimately can improve the health and well-being of all our Monroe County residents in the month that COVID shut down our country and much of the world. And when in kind of thinking back about all that we've been doing over the last almost 2 years, I think this is why this is such a good story. And I'm really kind of excited to share some of our learnings and what we're attempting to do. So let me share my screen. Okay, so this is sort of an overview of the first, the beginning in April through December of this year. And I wanted to kind of talk, in terms of thinking about our Monroe County project, there are 2 theme areas. So one is how, as a community, do we identify who those underrepresented voices are in Monroe County? How can we engage and begin the process of bringing them into the project and listening to and understanding what they have to say and their perspectives. And at the same time, we're also talking about trying to figure out ways to really sustain those voices and sustain our ability to really, as Amanda was just talking about, impact policy decisions. So we had a track to say, okay, who are the people that need to be at the table? And those include the policy and decision makers here in our community. And kind of also then thinking about what policy and decision makers need to be thinking about to really include more voice and more understanding of sort of the issues facing our community. So those are sort of the 2 tracks that we've been paying attention to over the last 2 years. And so we spent the first 5 to 6 months really doing a lot of background information, looking at demographic information, identifying how decisions are made here locally. And we interviewed over 60 folks to get their input on what was happening from their perspectives. And we kind of used 2 lenses. We wanted to know about health and issues that they saw facing our community, and also how they viewed how decisions are being made and sort of what kind of public engagement opportunities have been going on in our community. And that information then informed the work that we did from October of 2020 through June of 21, where we identified and hosted, well, first we formed an advisory council, and right now we have over 40 members, and they represent members of underrepresented communities in our community. It includes decision makers and elected officials. So it is a broad kind of cross-sector group that has been working with the project since September of 2020. So once we, so in these small group discussions, we really targeted different stakeholder groups to really understand what they were thinking and what they were understanding. We asked them 2 questions, really simply. What is important to health to you and your family? And what do you want decision makers to know about that what's important to you. And so we were really looking at trying to identify what are the issues facing folks that are often left out of the discussion, and really deepening our awareness. From those conversations, then we excuse me, from July through December, we opened up the discussion to a broader audience, to the community at large, and said, all right, we want you to come. These are the 3 theme areas, and I'm going to show you those theme areas in a moment, that we focused on. We want to understand how you're understanding those 3 areas of concerns, and what experiences do you have related to those themes. We also then got them thinking about how we could begin to brainstorm and move towards sort of solutions and problem solving. And so we kind of framed these sessions that we hosted this fall, and we just sort of said, as we think about these issues facing our community, if it was up to you to solve it to the group, as if we owned the problem, how would you begin thinking about solving it? So we asked people to talk, also to consider ways to sort of, excuse me, address those issues. So I'm gonna stop there and go on to kind of talk. I wanna kind of talk to you then. So over those almost 22 months that we've been listening and interacting with over close to 300 folks now, here's what we started hearing about public engagement. We heard that 3 minutes at the microphone is not effective. We heard a lot of frustration from community members and fatigue with listening and input sessions that we're sort of hearing around the community that appear, or with our elected officials, that appear to have little impact on actual decision making. Sort of the quote, one of the quotes was, seems like their minds are already made up. Lack of our community's understanding of how policy making processes actually get done and what policymakers have to consider. Frustrations with divisiveness that we were seeing throughout the community, and each sort of group identified different areas of divisiveness that they felt were impacting our ability to really solve problems. Feelings of being drowned out by the loudest voices in the room, too many silos, challenges identified for really effectively reaching out and engaging with historically marginalized communities. We heard a lot about that, about how do we do that effectively, and who do we need to be reaching out to? We heard about the barriers related to resources and time, and the commitment that's needed to really effectively engage with folks over time. And we also identified that there were strategies needed for eliminating barriers to participation. So we spent a lot of time throughout our project figuring out how to eliminate barriers to participation. And then we heard a lot about lack of trust in institutions, leaders, and political processes. Here's what we heard about health equity. So those 3 areas, after listening to almost 200 folks identify what was important to them and what they wanted our leaders to know, they really identified issues with health insurance, the importance and concerns. People talked about having to choose between insurance and other basic needs, such as food, shelter, or clothing. Folks that didn't have insurance identified being terrified to get sick on the weekends when Health Net was closed, and that meant they were going to have to end up at the emergency room. Health services, the availability and the quality. So a lot of people talking about long wait times for appointments and finding good health services that are available and affordable. And a lot of folks focus on feeling experience of bias and unequal treatment they felt from some healthcare providers that they were interacted. And then, of course, there were just the general community health challenges that Amanda was talking about. challenges understanding how to receive services, limited availability of good housing, public transportation, and healthy food options. But the good news is, and this is why we're here this evening and excited about this opportunity, is that there still is a strong belief that it is important to speak up and that community members really do want to be heard. And they want those opportunities to tell their stories. And the other piece that I think is really important is I think that the impacts of COVID and our collective experiences kind of dealing with racial reckoning that has been also going on, which has just pointed out the inequities that exist in our community, has really increased community members' commitment to making changes that level the playing field for all. So there's a strong desire to see change, and that's why we're here this evening. So over the next 9 months through August, we have still a lot of work to do. We need to continue to strengthen this advisory council and how we can continue to strengthen action for prioritizing these challenges that are facing us and discovering those solutions. And we need to continue to share our learnings. And we really need to work with our advisory council. We're looking at the vision and the structure and the leadership. And then we're also looking at opportunities for future funding opportunities and future ways that we can collaborate to sort of build on this framework that I feel like we're beginning to lay within the community. And for you all that are here tonight, we're going to take you through a journey to really look at ways that not only can you listen more effectively, but that maybe could really sustain voice action and really lead to more shared leadership. So I'll stop there. And just a second, I can't do. I'm challenged right now. Oh, here. Sorry. And so I'd like to invite, we asked Matt and Kate, I can't see where you all are, to kind of share a little bit. Matt and Kate are both on our advisory council, as is Julie Thomas and Trent Deckard. So Kate, I'll start with you, and I just kind of share a few reflections on what your experience has been throughout the project and what you think about moving forward.
Sure, thank you. Can you hear me okay?
Yep.
Oh, sorry. Kate, go.
It's Kate Wiltz, not Kate Rosenberger. We're not putting you on the spot, Kate Rosenberger. Go ahead, Kate Wiltz.
Okay, can you hear me? It says my internet connection is a little unstable. So hopefully this is working. I was thinking about the work that has been accomplished with this advisory council and where we've been and where we're headed. And, over the past 2 years, if there's one thing that we've become increasingly aware of, it's the relationship of public health and public policy. And, we've watched as our local health department has been navigating just a minefield of messaging, services, and regulations. And we've seen misinformation and mistrust impacting the health of individuals and our whole community. I mean, even right now, our hospitals are reeling, and we have been unable to even offer elective and preventative services because of COVID-19. So I feel, the timeliness of this. And the thing is, though, everything we see or read about with respect to these public health challenges impacts disproportionately people of color, people who are unhoused, people who are struggling with low incomes and no childcare, people whose gender identity is questioned by some even in the healthcare industry. and people who are or have been navigating the criminal justice system. And the Community Voices for Health project couldn't be more timely in bringing these disparities to light and forcing us to consider them in our public policy. Being a part of the information gathering stages of this project has highlighted for me the possibilities that we have as policymakers at the local level to act across disciplines and to remove barriers to create a more resilient community. Better health policy leads to better health care and in turn to a healthier community that's better able to face the challenges of a changing environment, whether that's the post-pandemic economic strain or the inevitable increases in severe weather events. I'm hopeful that we can learn from this project and do the intentional, deliberative work to incorporate those lessons into the way we approach public policy in Bloomington and Monroe County and the surrounding area. So I'm looking forward to working with everyone. I'm really glad to see all of you here. And thanks to CJAM and Gnarly Tree and the other partners for bringing us together and bringing this work to our community.
I can jump in if that's all right.
Yeah, or Matt.
Thank you, Liz. Yeah, and thank you all, colleagues, for being here. Like Kate, I think this project is really important. The topic's really important. I've been excited to be involved from the beginning of it. I think equitable public engagement is important to us having a just and inclusive government and community, and it's not something that local governments have always done well. Any policy that we develop or existing policy that we perpetuate has the potential to create or sustain inequities, and we need processes to help us interrupt that status quo and reach more equitable outcomes. So with health specifically, like Ms. Hunt mentioned at the beginning of this meeting, I think it's easy to immediately kind of jump to health care, and I didn't think of that as an area where the city council necessarily has a lot of a role to play. But of course, health is so much broader than that, and we've got social determinants of health that we play a role in all the time. So there's lots of upstream policy interventions that can have significant impacts on health. Again, some of those have been mentioned, from transportation policy, whether you can safely get to a bus stop and how long it takes you to get there, whether you have a sidewalk to walk on and whether that sidewalk is covered in snow. Zoning and development rules, who's required to live where by the virtue of the type of housing you can afford to be in. But this project to me is, and what's exciting about it beyond the health aspect and the health lens and the learning we're doing there, is the idea that the lessons can be scaled and applied to other forms of public engagement and policy issues. We need to be more inclusive in our engagement across all policy decisions. And I think we as decision makers will be better informed, especially by people who have been historically and currently excluded from our systems, and hearing about their lived experience. So I don't think that's the norm in public engagement right now, and at least not in my experience in most cases. And I think we need to continue to work on that. And I think in the last couple of years on council, the most difficult issues for our community, when people seem to be really at odds with one another and really exasperated, come down to process failures of some kind. And I don't think we're well served by our current processes to deal with these sort of difficult, intractable, sometimes seemingly intractable problems. I thought of the note that Liz made in her brief presentation about it seeming like our minds are already made up. And I've had a constituent tell me that before about an issue, and it was with annexation, actually, I'll just be frank. And it was near the end of that process. And I sort of pushed back and was like, well, I'm not saying my mind is made up or that it could never be changed, but I've been thinking about this for months and engaging with constituent for months. And yes, I have a pretty good handle on like where I am on this issue at this point. But I think it's not, what that spoke of to me is that we're involving people at some level at the wrong stage in the process, that this idea of debate at the final meeting on the final vote is not effective, and people know it. So that's what what I took away from that quote from Liz earlier tonight. So finally, I'll just close by saying I think this requires a willingness to change, to try new things procedurally, to recognize that the way we've always done things may not be optimal, especially with respect to equity, so that we can make, boards, commissions, our public engagement process more collaborative among branches of government, more publicly accessible, and more inclusive for all. So I hope that we can draw lessons from this multi-year process. I've been really impressed with the organizers and all the partners involved, and I would appeal to my colleagues to really stay involved.
Thank you very much. That was great stuff. Very thought-provoking. I really appreciate both of your comments. I'm going to go ahead and introduce or turn this at this point over to Terry Amsler, who's going to really talk about sort of what Matt and Kate were just focusing on, strategies for strengthening policy and decision making by municipal governments. And I'm going to turn it over to you, Terry.
Thank you, Liz. And let me add my thank you to each of you for being here this evening. Busy day, busy evening, and thank you for your time. Let me start this way. Grants, such as the one we have, and we're fortunate to have from Robert Wood Johnson Foundation, are wonderful and important, and they end after a relatively brief time. And however, what's learned and retained and built on by communities often is more important than what happens during the grant period itself. And in this grant that we're doing presently, this grant ties issues of health, as Liz has said, and others, including the social determinants of health, to strategies for more inclusive community voice. Now, we're adding learning to what decision makers, whether county, city, direct health providers, whomever, already know about health and healthcare needs. That's a very important takeaway. We're also adding new outreach, engagement, process strategies, equitable process strategies, to effectively reach out and hear from those who may not be heard. That's also important, and Liz has described our work there. But my job here, for just a very few minutes and without slides, before I turn to Amanda, and she will go deeper into some of these things, is just to describe some of the materials that we're collecting and putting together and making available for you. It may assist in helping you as elected officials think about how such voice opportunities has been practiced, demonstrated, initiated with CVHMC for shorthand, how they may take additional forms and may be sustained in Monroe County and Bloomington, perhaps other places around the state over time. So my job to tell you a little bit of information. Now, I have no interest, I'm not trying to persuade anybody. Our job here, what I'm talking about in CVHMC is like, we can provide information through this funded project to you in service to, I think, the larger interests and goals that we're talking about. And that's one of our jobs. We can do that. So we've created, with the help of IU O'Neill grad students, a document called Selected Resources for Municipal Development of Health and Public Engagement Related Plans, Practices, and Policies. Long title. It's in your materials, as you know. Now, this is intended for you. It's written for you. It's other local officials, because hopefully it's a way to take some of what we've seen, including what Alterm and Public Agenda, the intermediaries for Robert Wood Johnson, and other communities have done with public engagement and health, comprehensive plans, health and all policies, and I'll explain this more in a minute. But what's out there? And what can we do to put it in more usable forms for you? So we've got this document. It's relatively short. It's about 8 or 9 pages. It's an inventory of links primarily. And it's a public engagement principles, good practice principles from municipalities and communities and counties around the country, as well as some guidance documents from others about public engagement principles. Public engagement principles help sort of set a sort of a template for how communities think about their engagement, pursue engagement. So we put together some good examples about public engagement principles that any community can endorse as, yes, good guidance principles until we change them in the future. Let's go with these. We've also put together a section of this document on health chapters or sections, if you will, or elements in some cases, and as well as other health content relating to health and social determinant of health, content and comprehensive plans in Indiana and around the country. How are communities, cities and counties thinking about their comprehensive plans? Some of this is just, I say just without diminishing it, simply language that shows up in parts of plans in various ways. We've also put in examples where cities and counties have created full chapters or sections around health and social determinants of health, brought it together in some way, helping to sort of create understanding of interactions or participation that raise and discuss issues that bring things together. That's part of it as well. And then there's a section on health and all policies. And Amanda will say more about this, but these are both, as with the other sections, guidance documents for how put together by municipalities, by states, by independent organizations about how to develop health elements in comprehensive plans. How do you do good health and all policies work? As well as practical examples from cities and counties around the country and Indiana, where it's happened. So all this put together for you. Now, there's a caveat a bit here. In Bloomington and Monroe County, you're doing public engagement. You know that already. So we don't start from scratch here. We start based on what's happening already and offer an inventory of resources relating to all these arenas of public engagement and health, process, and infrastructure that might be helpful. Again, to help in sustaining what we're trying to help support with many others through CVHMC, to give life over time beyond when the grant period ends. And that goes back to some of these particulars. So in this, I want to say just briefly, let me check my time. I want to pay some attention to what I'm doing here. I'm okay. Let me just say a couple of things. In this document, which again, take a look at when you can, it's there as a working document for you. We have city and county comprehensive plans. And I say there's a section that's guidance documents for helping develop health-related content for municipal plans, or county or city and other municipal plans. There's examples. Most of these, except in one example, are pretty much outside of Indiana, but some really interesting examples where a city or county have put together full sections or chapters that's fully focused on health and social determinants of health in their comprehensive plans. It's an interesting exercise for both participation and for planning, actually. And then you've got also just some general health-related language and content focused a little more, in this case, on Indiana. We've had students look at and pull together from throughout Indiana, from cities and counties, what language around health is showing up. And we put that together, again, through links. Some of these are excerpts pretty much completely that are put together, and there are links in this document I'm talking about to the CGM website and CVHMC website, I should say, where you'll find these materials. Now, so that's the comprehensive plan piece. Health and all policies, same thing, guidance documents, as well as actual resolution and ordinance examples. What does a city or county what's an actual example of a health and all policies piece that someone put together in a real place? What does it look like? Why was it done? What are the whereases as well as therefores to it? And then lastly, not less importantly, but in the order I'm giving, which is sort of working through the content of the document I'm talking about, is municipal, public, and city and county, I should say, is the better way to say this, public engagement principles, values, and practices. These include good public engagement and best practice or effective practices guidance from cities and counties around the country and other places. Examples of public engagement principles, real life city and county principles that they have put in place in their community. Again, selected public engagement content from Indiana, city or county comprehensive plans. These are excerpts, just where we could find language, we put it together. This includes Bloomington and Monroe County, of course. And then finally, we've got examples of public engagement related policies and ordinances. And this is, I will do a shout out here because it's so darn interesting. Portsmouth, New Hampshire has a city council revised rules and orders that includes a somewhat unusual for these sorts of things, council and public dialogue opportunity at selected council meetings. It's kind of interesting. And these materials that are provided give you a link right to that city's city council webpage with the actual rules and revised rules and orders. It's kind of interesting. Let's see. So those are some of what's in the material. So my job is mainly to say, look, we're trying to put materials together to be useful to you as working documents to go forward and may hopefully be a kind of foundational piece for some of our discussions as they may take shape in our next meeting on the 21st of this month, which goes back to this question of how you develop health and social determinants of health are not individuals' sole responsibilities, not a community's sole responsibilities, nor local officials' sole responsibilities, a little bit for everybody. So we're looking, and what I'm talking about is simply this part that thinks about what are some of the policy-like frameworks, practices, policies that might be useful. What could be done here, which is more for you to think about, perhaps with us over time. So anyway, these are primarily guidance, examples, and documents, as I say, helping advance capacity for city and county practice plans and policies that are more equity-based, we hope. And one thing I'll leave you with this, I think, before seeing some briefly any questions before turning to Amanda. I'm hesitant to do this, I admit. One way to think about this, there's community health, and then there's political civic health. And I think one of the things that we think about a bit is how do you also structure political and civic health to match up to equitable voice and participation. And we're looking, because this grant, because of Robert Wood Johnson's thinking about these things, pulls together engagement and voice. So it's an opportunity to help, for us anyway, in CVHMC, prevent information that crosses these lines around participation, voice, and health, and see what might be useful as a way going forward. So I should definitely stop there, turn this over to Amanda, except to say if there's any, because we are just about out of time, but are there any immediate questions or response anybody wants to share at this point before going forward? I may not be able to see everybody on screen at one time, so I'm going to quickly look at the other screen. I'm looking for hands. So seeing none. Well, thank you for letting me share this with you. And I will ask Amanda if you will take it from here. Thank you, folks, again for being here tonight.
Okay, thanks, Terry. Annalisa, can you flip us over to the next slide? So a number of our speakers tonight have talked about how community perspectives can be a valuable tool for policymakers when it comes to addressing health-related issues in the community. And I'm going to talk about one way that local governments can create opportunities for public engagement and health decision-making called health in all policies. Next slide. Health in all policies may sound complex, but at its core, it simply represents a shared commitment among government officials to consider health when designing policies and making decisions, in recognition that health is shaped by many factors beyond the scope of traditional public health activities, and that healthy people contribute to healthy communities, for example, by making up a healthy and productive workforce and supporting better academic performance among students. Next slide. When done well, this process incorporates community input to help local decision makers understand the health benefits or consequences of policy proposals on different groups of people, and ultimately ensure that policy decisions give all community members equal opportunity to live the healthiest lives possible by creating environments that are conducive to healthy living. And because studies show that people living in low income and minority neighborhoods are most likely to lack access to things like supermarkets selling healthy foods, and are more likely to live near sources of air pollution that contribute to asthma and other health issues, it's particularly important to make sure that these people's perspectives are considered when examining the potential health impacts of a particular policy or idea. Next slide. So what do communities stand to gain by adopting a health in all policies approach, and specifically one that engages community members in health decision-making? Potential benefits include decreased likelihood of unintended consequences resulting from decisions made without considering health. Fewer health problems means a higher quality of life for community residents, a healthier workforce, and better academic performance among students. Next. Increased community participation in local decision-making, which fosters a sense of place, community pride, and empowerment. Next. Increased ability for local policies to be responsive to community members' needs and priorities, which increases satisfaction with local government. Next. And it allows government departments to leverage resources and increase efficiency by pursuing multiple goals through one effort. So an example of this is passing a mixed-use zoning policy that allows local businesses to be located near residential areas, which supports business owners by increasing the visibility and accessibility of their establishments, while also increasing neighborhood walkability and supporting social interactions in the community. Walkability supports physical activity, which in turn decreases the likelihood of obesity-related illnesses, and more opportunities for social interaction helps improve mental health and reduce loneliness, which has health consequences for elderly people in particular. In this case, adopting a health lens when thinking about city planning resulted in one decision that satisfied 3 different goals across multiple departments. Next slide. Many communities across the country in both conservative and progressive states are adopting a health in all policies way of thinking, and there's no one right approach. Again, it simply represents a commitment to thinking about potential health impacts when various policies, programs, and other decisions are being considered. But I want to provide an example of what this can look like to hopefully make the idea feel a little bit more concrete. Health in all policies approaches typically start with an ordinance, a resolution, or an executive order. If one of your goals is to make sure community residents are included in the discussion, which we strongly recommend, you can ensure this happens by including that language in the ordinance, resolution, or executive order itself. Establishing documents can be either broad or narrow in scope. An example of a more narrow health in all policies approach would be the resolution you see here, which was passed by a local board of health and applies exclusively to health department policies and procedures. A broader example would be a resolution or ordinance passed by a city or county council directing health to be factored into decision-making across different sectors, which would require collaboration between multiple government departments. A community interested in pursuing health in all policies can also start out narrow and expand the scope of the effort later on. I'll share an example of what that looks like on the next slide, but the main takeaway here is that health in all policies approaches can take different forms depending on the area of government you represent and what makes the most sense for your community. Next slide. I wanted to share this example from Tacoma, Pierce County, Washington, because I think it does a particularly good job of making sure that community residents are consulted when it comes to understanding how a proposed policy or decision might affect community health and well-being. The Tacoma Pierce County Board of Health passed a resolution in 2016 directing health department officials to consider health in the development and implementation of all policies, budgeting, and service delivery. What's particularly valuable about this resolution compared to other ones that I've seen is that it, one, states that community residents should be consulted when developing and updating policies to consider health. And two, it directs health department officials to engage specifically with the communities and stakeholders who are likely to be most affected to ensure that decisions incorporate community knowledge and perspectives. While the Board of Health's resolution applies only to the local health department, the city of Tacoma actually adopted its own health in all policies resolution shortly thereafter, becoming the first city in Pierce County to do so. And according to community stakeholders, really setting the bar for what the future of health could look like in Pierce County. Next slide. When it comes to putting health and all policies into practice, many communities use decision support tools to help officials think through the necessary questions and make educated decisions about whether or not to move forward with a particular proposal. Tacoma Pierce County, Washington's Health Department uses a health lens analysis tool, which asks a series of questions that not only prompt local decision makers to think through whether and how different groups of community members might be affected, but it also prompts them to solicit input from those groups directly. Next slide. The tool asks questions like, which groups of people are likely to be positively impacted by this proposal? Which groups of people are likely to be negatively impacted? Which groups of people have you consulted when developing this proposal? And who have you not consulted that might be affected? The goal of these questions is to simply gather the necessary insights to more thoroughly understand potential future effects that might not be initially apparent. If the proposal is expected to have a negative effect, the tool asks if and how the proposal could be modified to reduce those risks, as opposed to requiring that the proposal be rejected altogether. Next slide. The other thing that I really like about this tool is that it provides a list of different groups of people for decision makers to consider when thinking about who might be helped or harmed by a policy and or who should be consulted. Examples include, but are not limited to, low-income earners, people of color, people with disabilities, elderly people, and people who live in rural areas. And while I think that this Washington example does a really great job of incorporating the perspectives of people who have traditionally been left out or underrepresented in policy discussions, I want to underscore that there isn't one right implementation tool. This is one of many tools being used by local governments across the country. Next slide. And finally, I want to talk about some of the many steps that tend to happen before a community decides to embrace a health and all policies approach. In many communities, visioning is the first step. Local leaders ask themselves, what does the phrase healthy community mean to me? What does the phrase mean to community residents? Luckily, Community Voices for Health Monroe County and the 2021 Monroe County Community Health Needs Assessment have already begun gathering this information. Next. The next step is a community/existing conditions assessment. And this is where decision makers ask, how does the collective vision of a healthy community differ from what exists in the community today? What issues, needs, or barriers currently stand in the way of realizing that vision? Next. And finally, local leaders might find it helpful to think about ways that health and all policies can be incorporated into their existing work. Are there any policies or projects being considered that have potential health implications? Are there any existing or newly forming interdepartmental initiatives where a health perspective could be potentially valuable? Is there council, office, or department going through a strategic planning process? Or is there a new or ongoing process where health metrics could be added? Maybe there's a particular health-related issue that's concerning community groups. Are they asking for something to be done about it? And ultimately, the answers to these questions can be used to inform community leaders' idea of what health and all policies could look like and what they wanted to accomplish. Next slide. So that is the end of the content that I've prepared for our discussion today. I think we have a few minutes for some question and answers if people would like to ask anything. Otherwise, we can move on to the next portion of our agenda.
I'm looking for hands. Are there any questions? And if I can't see you, just shout out your question if you have anything for Amanda. I might mention that in the documents that I described earlier, there
Sue,
are.
Sue has a question.
Oh, I didn't see, I can only see one page at a time. I didn't see. Go ahead, please.
Yes, thank you. I appreciate the resource list. I think it's kind of fascinating. I'm curious, could you say more about how you decided what to include and what to exclude on that list? Because my guess is there are more cities that actually have those elements in their comprehensive plan. Do you see this collection as kind of the best of the best? Are there others you eliminated? And if so, why? Could you talk more about that?
Sure, I make sure I'm not unmuted. Yes, I'd be happy to. These are not, particularly in terms of some of the guidance documents, I think there was a more of an intentional effort to put together the guidance document to be pretty solid, pretty good, pretty representative, pretty accessible for us here. In terms of the excerpts from, say, language of comprehensive plans, it was good student research going through and finding what was there and highlighting them. There wasn't, the students took a look through now I can't say they went through every single city and county plan in Indiana, but did a scan through city and county plans. And those are the ones that were there. So if there weren't, when we looked for full chapters or sections in health, there's not as much in Indiana. There are full, complete health chapters or sections or elements in comprehensive plans here. But it was a scan. And even especially the excerpt pieces from the comprehensive plans, whether it's public engagement excerpts or health excerpts, was pretty much a quick scan, pulling what seemed where there was something enough there to pull out to make available, to put in the book, recognizing that with this an inventory of links and having 1,000 links is probably not any more helpful. So there was a numbers thing to it as well. We didn't exclude anybody on any criteria particularly, as long as there was something there and we found it from the cities and counties we put in. There was some, when we were looking for full health chapters, we found some outside the state, for instance, for health and comprehensive plans. But it certainly is not intended to be the very best, because that would be more beyond the scope and intent of what we were doing.
Can I also kind of build on what Terry just said, Sue? Is that we were looking, in terms of finding some best practices, and sharing some of those resources, we were using some other lenses, like being sure that we really looked at how they were engaging with the community. And we wanted to see a strong element of that built into what example we show. We also, I think we're looking at communities that have strong dashboards that are really measuring themselves against this community vision for health and how they're setting, more specific measurable outcomes to show that there's progress. So there's some of that you'll see in those examples. And certainly, we continue to look for additional good examples. So for the work that we're doing with the advisory council right now, where we're looking at, again, best practices around the country of how communities are, incorporating consistent voice. And so again, we're using the lens, we're looking for examples of collective community advisory type councils that are either embedded within municipal governments, that are standalones, that are housed within nonprofits. But again, we're looking at those that really impact decision-making and finding those examples. So I don't know if that helps.
I appreciate that. Thank you.
If I could just jump in, I know there's a section of the resource guide that is relating to health and all policies, and I provided a lot of the resources in that section. I will say that in our other work, but also in preparation for the discussion tonight, myself and my colleague Annalisa has done a lot of research into different health and all policies models. And I just want to clarify that a lot of health and all policies models do not have a strong public engagement component.
Right.
I mean, you can have decision makers sit around and think of, well, who might be affected by this? Who might be positively affected? Who might be negatively affected? And never actually talk to community members, let alone different groups of community members, all with very different lived experiences. And so one of the reasons why I shared the example from Tacoma, Pierce County, Washington, is that it really stands kind of alone on a pedestal when it comes to models that can be emulated, that are examples of good health and all policies, but also have a really strong public engagement component. So I will say in terms of health and all policies, we feel fairly confident that this is one of the best examples that you'll find in the country.
Yeah, and it's been interesting in looking, because they have had experience, since, what did you say, 2016, when they passed the original ordinance with the health department, and then subsequently, passed it at the city council level. They have developed such a good discipline for learning how to identify those groups of folks that need to be at the table. And so when COVID hit, to give you an example, they were able to pull together a group of 80 community organizations that worked with the county health department to identify the areas of most concern, very quickly identified what resources were needed where for getting services to underrepresented folks, and came out with this incredible plan for addressing equity issues related to COVID. And they did it in 6 months. They were able to turn that quickly because they had developed this discipline and they had those connections with over 80 groups in the community. So it was really an amazing thing to kind of read about.
I wonder if I could just say one last thing on this topic and then see other questions, and also we have time for discussion here. But there are, this is an example, within the public engagement principles examples that are provided in this document, selected resources document. There's a number of very, very good examples, but each community makes its own. There's not a one fits all kind of variety for these things, nor should there be. So you'll see, I think, across the board here, there's always an important element of homegrown. I think that's the idea, which takes us back to public engagement, actually. And as Amanda said, the Tacoma Pierce County Board of Health HIAP resolution is in the document. City of Richmond, California, their full ordinance is in there. It includes their findings, definitions, and implementation pieces as well, which is quite instructive, actually. So but are there any questions for Amanda, or we'll open it up a little bit more broadly from that, but I want to make sure, and again, I'm only seeing about half the screen at the time, so just shout out if I'm not seeing you, please. Any questions for Amanda?
Yeah, I have a question. We've been really concerned in terms of public health with vaccinations through COVID. Are there other ways that we could have reached out to different groups? And I guess we would have had to have had these relationships in the past to increase our vaccination rates locally, to fight COVID in a different way, to have better compliance with masks, just all kinds of things, so that we could have reduced the stress on our local healthcare system and reduced the spread, increased vaccinations, all those kinds of things.
That's a great question. And I'll start out by saying that my organization, Altarm, is the health policy expert on the project, whereas Public Agenda is the engagement expert. So I'm sure that they would have a much more thorough answer for you. But through some of the other work we've done, I mean, I think what's really, kind of been impressed upon me is the power of tapping into community leaders or community champions. And so if you can identify the people in the community that a lot of times they don't have an official title. They are just people that others naturally look to in the community. That seems to be a very common way that I think people are trying to kind of reach broader groups of people, combat misinformation, because a lot of the times the success of an initiative doesn't so much depend on the message, but actually the messenger. That's a really big thing that we oftentimes see, especially with COVID. So that's kind of the extent of my thoughts. I wish I had something a little bit more concrete for you, but I, invite anyone else from the Indiana team who might have done some thinking on this to jump in.
The only thing I'd say, and I think particularly questions like that are situational to place to some extent, of course. But if you look, and I can't speak for public agenda, but thinking about public engagement literature generally, partnerships, which you all already know are so important, established partnerships to build on relationships, and use of communication media that reaches people where they are and that they look at. Media accounts, ethnic and other media accounts. Also, clergy and congregations count as media, as communication vehicles as well. There's nothing new about any of that, I tell you. But those are the things that show up.
I also think too, a little bit, and part of, again, this is the CJAM mediation model of really, partly under really being able to identify what those barriers are for the different groups that you're talking about. So before, going with a message, really understand what the barriers are. So, if you look at Native American communities across the country that had such high COVID death rates, well, part of what the communities began to understand was that 30% of people, of Indigenous people living, on, their, the areas, I don't know, on reservations, 30% of them do not have access to running water. So when you begin to identify, so you can't begin to think, well, what's my strategy for getting people to get vaccinated or understand the impact or social distancing until you understand what those challenges are for those people. A lot of people living in urban areas that are low income, where you have multiple people living in small apartments, the ability to really effectively social distance was really difficult. So I think that's another part of why it's so important to be developing those relationships so that you can more fully understand the issue.
I wonder, I'm asking, I'm trying to, as I am playing a minor facilitation role in this part of the meeting, but I want to just call out before I forget that the next meeting is February 21st from 6:30 to 8:30, and it's a possibility that we're just beginning to open up some things that could be discussed then. But also, I didn't know if it'd be helpful to just take a minute for local officials in the room for just opportunities to hear your own reactions to any of this, thoughts of opportunities or ideas. And this is not set up as a deliberative engagement session. We're not enough time to back and forth it a whole bunch. But we'd love to hear, our team would love to hear just reactions and thoughts, opportunities, challenges to any of what has been talked about tonight that you've learned and maybe didn't know before about CVHMC. Anything at all?
Sure, I'll speak. One of the things I noticed is that we do not have a single person here from a township trustee or township board. We don't have anybody here who's elected official in Steinsville or Ellettsville. So we are not even reaching out to all the elected officials. We don't have anybody from the sheriff's office. We don't have anybody from the prosecutor's office. We are missing so many parts of our community that we need to engage with.
Thank you. I'm looking for other hands, but just feel free to shout out. We're not so big a group. I think that if someone wants to speak, they just go ahead.
Hello. I would like to second what Penny Githens just said regarding township trustees and boards. The trustees are the first line government interaction with people needing services. in the townships, and this is an essential service because the trustees have the funding to provide medical supplies, and they have additional funds for housing. And I can't imagine that we should be going forward without cooperation of all our trustees. Thank you.
Trent, your hand's up, I believe.
Thank you very much. And, like Kate, it's been a real pleasure to assist with the advisory council and really watch you all go to work in making folks pause, reflect, and talk about these things. And one huge takeaway that I have picked up throughout this, and particularly tonight, as you offered a recap to our colleagues, is that our constituents are living some very non-gentle lives with a lot of difficult and rough parts, and they often they may not have time for the reindeer games that go on in how local government can work, and or any government level at that part. And it strikes me that we need to figure out, not only in our policy but in our methods, some gentleness towards where they're at and reaching them. When we think about the things we need in health, our healthcare serves as a remedy to our situation. And I think for our end, on the public service end, I think there's a little bit something to that, not just with these issues, but just about every issue. I mean, there's been good comments tonight about how difficult discussing public policy is. And we got to figure out on our end if it needs to be that way anymore. And what we can do to alleviate that at any level. And, if we can't figure that out, it's a life well spent. But I think there's good things that can come from some of this. And I'm grateful for you giving us a chance to talk tonight.
Thank you. I'll work across my screen left to right where I see hands going from Trent. I see Mayor Hamilton. And then I see Councilwoman Piedmont Smith following. Yes.
Well, thanks a lot. Can you hear me all right? Yeah, you asking for reactions. Thanks so much for sharing this. I think three reactions. One is, yes, this deep reminder of the breadth of health, while I certainly feel the importance of focusing on traditional health and measures and interventions of health and what we do locally in that, both from the governmental sector and the direct care providers and others, because there's a lot to be done on that. But also, of course, the much thicker, richer engagement on what public health is and what being a healthy place is, from housing to education to transportation to built environment to all kinds of stuff. So that was one really strong takeaway. I think the second for me, yes, hearing the not about us without us, the importance of all voices at the table. How as a community we always struggle with that to do as well as we can, whether what kind of public meetings do we have? How many of them are they? What time are they? What are, do they have childcare? How do you get to them? And how do you solicit voices that just don't participate in traditional means? How important that all is to us. And then I guess a third thing I'd note was just I didn't hear a lot of talk about resources. And I do feel like, knowing that Indiana is one of the worst funded public health states, at the small definition of public health, is one of the worst funded public health states in the country, knowing that we have major impediments to things like affordable housing and such in policy arenas, looking locally, what kind of resources do we have from the state or locally to invest in health? I think I think money and investments are really important too in addressing these things and reacting, knowing our context, knowing our environment. That's really important too. Financial resources. We of course have tons of other kinds of resources too, but those are just some quick reactions. Thanks.
Thank you. Councilmember Piedmont Smith.
Yeah, thank you so much for the presentation and for this several year undertaking. And I look forward to reading the links that you sent and hearing the outcomes of your deliberations and your engagement. So my main concern is, so how do we engage people who have not been engaged to this point? And I totally understand if people aren't, because the workings of local government are arcane and, you know, on a schedule that not many people can afford to follow and things like that. But I guess I'm hoping that one of the outcomes of this process is recommendations of how we can better engage members of our community who, especially those who have been underserved. So that's it for now. Thank you.
Thank you. And I think maybe one or two other hands, but Liz, I also know my time to turn it over to you is about here. So I'm checking to see if I should go back over to you for the last,
No, it's last 10 seconds. So keep asking. Pete has a comment, I think.
Sure. Here I've got 10 seconds. I'll be really quick.
No. You don't have 10
Liz was
seconds.
saying she won't need so much time. You have
So
time.
you can hold me that 10 seconds.
You're good. You're good.
All right. Well, thank you all for doing this. Really appreciate it. Full disclosure, my wife sits on the broader board, and I think she's gotten a lot out of this and has been able to participate and really provide a lot of that feedback, which is great. And I just wanted to highlight a couple of things that I was thinking about as you were presenting. And the first is the mental health is so important right now. And that's something that we don't hear a lot about. And certainly the health department and the county, we touch on that, but the need out there is so great. And it touches all socioeconomic statuses. And so I think that's something that we're certainly thinking a lot about. And I think the second thing that I think we're thinking a lot about now is criminal justice reform. And we are increasingly aware of just how large a role trauma plays in all of this. And of course, that all, is something that we're really wrestling with at the county level as well. So I think this is really prescient. I think I'm certainly going to be reviewing all of the links that you sent. I really thank you, Terry, for putting all that together. Thank your students too. And certainly those ordinance suggestions as well. So thanks.
Maybe one, and Liz, unless I'm getting into your territory, I would ask, and tell me if you want to do this part, but I wonder what more information people might want to have. One we might just ask you is.
I'm seeing Jim Sims with his hand up as well, Terry.
Oh, thank you. Thank you. I didn't see it. You must be on another page. Where are you?
Yeah, I'm always on another page.
There you are. I found you.
I'm always on the next page. How are you doing, Terry? And thanks everyone for this discussion. Just to add, and as we move forward, one of the things and there's been many concerns and positive and negative that we've talked about. But one of the things that really concerns me with community engagement, and particularly with underrepresented groups, is how do we build trust? And if you don't have trust, then you're not going to get information, you're not going to get participation. And we lack trust at this point in our government, local government, or our government in total. We lack trust in our healthcare system. We definitely lack trust in the criminal justice system. So I think that is an impediment that has to be solved one way or another through underrepresented groups to move forward and make progress in this area, even though I am encouraged as well. But those are one of the things that concerns me, building trust. Thank you.
Thank you. Jennifer, I think that's a hand.
It was. I was trying to look for my raise hand function. So as the new kid on the block, with trying to be here, this has just been, I've been trying to take everything that I've been learning over this past month and a half of being on the council. And so this, I appreciate this discussion, but Councilmember Sims definitely hit it on the head with trust. And I think one of the things that really stands out for me during this whole thing was the fact that how does political, I wrote it down, political and civic health, how can those things go hand in hand? And I definitely think that obviously trust is one of them. Being from, you know, one of those marginalized communities of color, we definitely see, it's no surprise that our community definitely sees the divisiveness that happens within the government entities, whether it's, you know, the same or cross government entity fighting. And that definitely breaks down the trust. And I think we have to look at ourselves and figure out how can we start attacking the issues and not the people that are bringing these issues together, and how we can build upon that trust as well. And I think it goes to the saying that we need to start going to people where they are instead of just assuming that we have all of these great resources and tools of readily available. I agree, these things are great, but they only are great if they work. And they work when people know about these things. And if we are doing our jobs and our due diligence of really truly seeking and being very intentional with meeting with these groups, because it's really no longer good enough to just say, oh, we need to look around and see, you know, who's at the table. But we all know we can have a table full of people, but if you really don't pass the plate to the people around the table and keep skipping everybody, then they don't really have a voice. Then what is good as those people at the table? So I think it is, and you know, I'm preaching, but I'm looking at myself too as you know, a person coming in and trying to retain my seat and look and how I can play a part. And I just look forward to you know, working with this and working with the council and working with all you know, bodies alike, county and city, to make this happen, because we are the people that, you know, the people who trusted us to do this job. And, you know, we ask for their trust by votes or whatever the case is. And I think we have to really, truly earn that. So I've learned a lot, and I have a lot of notes here, and I will put myself back on mute. Thank you.
Thank you. I'm looking, just since I've missed people before, I'm looking again here. I think I have everybody. Well, Liz, I think we'll turn it back to you.
So our next meeting with you all is going to be informed by the conversations that we've started here tonight. We are going to be sending you a survey that has 3 questions. And if you could take a little bit of time and send it, you know, think about the questions, but do please send us back that information, because we're going to be bringing you together to do some of what you all have identified, what some of those barriers are, and really looking at that next meeting as more of a deliberative session. So we've sort of framed some of the issues. We've begun to frame some of the voices and the stories and the data. And there's a great document in the materials that we sent that really give you more detail in terms of the feedback and what we've been hearing and how we've been approaching the work. I'd encourage you to read that and really bring you together to get you thinking, just like we do in the deliberative sessions that we've been hosting this fall. If it was up to you, which it is, how do you want to begin to tackle making changes that you all have been identifying? So I want to thank you so much for your time. Really honored. Thank you. I am so honored to live in a community that our elected officials feel this passionate about these issues and that you're spending time and coming here tonight. And hopefully will be joining us on the 21st. That'll be a 2-hour session, and we're going to be breaking you up into 2 groups, and you'll have much more opportunity to dig deeper. So appreciate you all. Thank you so much. And bless and release. 2 minutes early. How about that? I love that. So thanks.